Okay, my name is Virginia Coffey, and I am an undergraduate student at Indiana State, and you're being invited to participate in my PE 483 class project. Your participation is completely voluntary. For the project, I will need to have you answer questions surrounding your health and current lifestyle. With your permission, I will videotape the interview process. If you agree to being videotaped but feel uncomfortable or change your mind for any reason during the interview, I can turn off the recorder at your request. The video will be shared with my professor and may be used in PE 483 for educational purposes.
Okay.
Okay. What is your name?
Rebecca Ballard.
And how old are you?
55.
Okay. We're going to start with the PARQ, and this is general health questions. Has your doctor ever said that you have a heart condition or high blood pressure?
No.
Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity?
No.
Do you lose balance because of dizziness, or have you lost consciousness in the last 12 months? Please answer no if your dizziness was associated with overbreathing, including during vigorous exercise.
Have I lost my balance related to dizziness?
Yes. Or
Yes.
lost consciousness.
No, I've not been lost consciousness.
Okay, so dizziness due to balance. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure? Please.
Hashimoto's thyroiditis. Or chronic lymphocytic thyroiditis. It's the same thing.
Are you currently taking prescribed medications for a chronic medical condition?
Yes.
Is it the Hashimoto's you're taking medication for?
Yeah, and breast cancer.
And what medications are you taking?
You want all of them?
Just for the two chronic conditions.
Natural desiccated thyroid. And metformin. And if they ask you about the metformin and they pop some dumb shit off about that being a diabetes drug, it's to reduce the amount of sugar in your body to lessen the cancer being fed.
Okay. Do you currently have or have had within the past 12 months a bone, joint, or soft tissue, muscle, ligament, or tendon problem that could be made worse by becoming more physically active?
Yes.
Which is the condition?
When I broke the joint in my right pinky toe. Because I kicked the tire without even trying to kick it.
If you answer no to all the questions above, you are cleared for physical activity. Please sign the participant declaration. You do not need to complete pages 2 and 3. So, you answered yes to one or more, so we're going to go ahead and go to 2 and 3. Do you have arthritis, osteoporosis, or back problems?
I have osteopenia and yes, upper back and neck problems.
Do you have difficulty controlling your condition with medications or other physician prescribed therapies?
Yes.
Do you have joint problems causing pains, a recent fracture or fracture caused by osteoporosis or cancer, displaced vertebrae, and or spondylosis, pars defect, a crack in the bony ring?
Say it again.
Do you have joint problems causing pain, a recent fracture or fracture caused by osteoporosis or cancer, displaced vertebrae, and or spondylosis?
Spondylosis.
Yeah.
My right hip.
So yes.
Yes.
What were you saying?
Do you need to know what?
It's not asking what, but you.
Okay, then keep going.
Okay. Have you had steroid injections or taken steroid tablets regularly for more than 3 months?
Yes.
Do you currently have cancer of any kind?
No. God, I hope not.
Are you currently receiving... Oh wait, no, we're going to question 3. Do you have a heart or cardiovascular condition?
No.
Okay. Do you have high blood pressure?
No.
Do you have a metabolic condition? Type 1 diabetes, type 2 diabetes, pre-diabetes?
No.
Do you have any mental health problems or learning difficulties? Alzheimer's, dementia, depression, anxiety, eating disorder? Yes or no?
Can you push pause?
No?
I have Xanax, but I don't think I take it for anxiety. I think I take it to keep from killing somebody.
So yes to anxiety.
Yes to anger.
But do you think you have anxiety? Have you ever been?
Yeah.
Okay.
I used to. Really bad. His name was WD.
Do you have difficulty controlling your condition with medications or other physician prescribed therapies?
No.
Do you have Down syndrome and back problems affecting nerves or muscles? But so that'd be no. Do you have a respiratory disease? This includes
COPD.
You do have COPD?
Mm-hmm.
Do you have difficulty controlling your condition with medications or physician prescribed therapies?
Sometimes, but not very often.
So would you say yes or no?
Yes.
Has your doctor ever said your blood oxygen level is low at rest or during exercise, and or that you require supplemental oxygen therapy?
Only when I was septic.
So that, but it's not part of your daily living, so that'd be a no. If I can't talk, asthmatic, you currently have symptoms of chest tightness, wheezing, labored breathing, consistent cough more than 2 days a week? Or have you used your rescue medication more than twice in the last week?
Yes.
Has your doctor ever said you have high blood pressure in the blood vessels of your lungs?
No. That's pulmonary hypertension, and no, I don't.
Okay. Do you have a spinal cord injury?
No.
Have you had a stroke?
No.
Do you have any other medical condition not listed above, or do you have 2 or more medical conditions?
2 or more.
Okay, so have you ever experienced a blackout, fainted, or lost consciousness as a result of a head injury within the last 12 months?
No.
Do you have a medical condition that is not listed, such as epilepsy, neurological conditions, and kidney problems?
Kidney
Yes.
stones.
So kidney problems.
But no, there's difference. My
Oh.
kidneys work fine,
Okay.
but I've had kidney stones.
I'm gonna write that to the side.
My GFR, or glomerular filtration rate, is where it's supposed to be. Greater than 60.
Do you currently live with 2 or more medical conditions?
Yes.
That'd be the Hashimoto's.
COPD. Breast cancer.
But you don't currently have cancer.
But it stays on my diagnosis.
Okay. I'm just
I know, but it's just...
Hashimoto's cancer, COPD. Okay. If you answered yes to 1 or more of the follow-up questions about your medical condition, you should seek further information, which you do because you see a doctor before becoming physically active. Delay becoming more active if you have a temporary illness such as a cold or fever. You are pregnant, which you're not. Please.
Thank God.
Your health changes, so just always talk to your doctor. Okay, we're gonna move on to your health history questionnaire. Your name is Rebecca Bauer, as stated before. You are recording, right? Like 100%? Okay. You are 55 years old, female. What's your family physician? Or who is your family physician?
Thomas Black.
What are you saying? 5 minutes and...
Yeah, it's okay, just be quiet.
Okay. Who is your contact in case of emergency?
You?
Oh. Virginia Coffee. Are you taking any medication, supplements, or drugs? If so, please list medication, dose, and reason.
Push pause. For
There
real.
is no pause.
I can't remember all of, okay, metformin.
Okay, we know what that one's for.
You need dose?
Yeah.
850 BID. You know what BID means?
No.
Twice a day.
Okay. For your medical conditions.
Okay. I can take a rescue inhaler, 2 puffs, as needed. Albuterol nebulizers, as needed.
Excuse me.
Magnesium,
I'll take magnesium too.
500 twice a day. Natural desiccated, just write NDT. And it's up to you to remember natural desiccated thyroid.
Okay.
Because I know you can't spell desiccated. 90 milligrams twice a day.
Okay. Does your physician know you're participating in this exercise program?
No.
Describe any physical activity that you do somewhat regularly.
Laundry. Dishes. I was sandblasting. Gardening. In the right season.
What?
Canning.
Oh, that, mixed with gardening.
Okay.
Do you know or have you had in the past history of heart problems, chest pain, or stroke?
No.
Elevated blood pressure?
Only when I was pregnant. With him.
Way to go. Any chronic illnesses or conditions?
Yes.
Yes. Difficulty with physical exercise?
Yes.
Advice from physician not to exercise?
No.
Recent surgery, last 12 months? Ooh, you went a whole year without surgery. Pregnancy now or within the last 3 months? No. History of breathing or lung problems? Yes. Muscle joint or back disorder or any previous injury still affecting you?
Yes.
Diabetes or metabolic syndrome?
No.
Thyroid condition?
Yes.
Yes. Cigarette smoking habit? Yes. Obesity? Based on your BMI?
No. Yes.
Yes.
Depends on whose BMI you're looking at. But yes.
Elevated blood cholesterol?
They want, no. Yes. Last one was, but I don't remember what it was. Like 216 or something.
History of heart problems in immediate family? That's unknown, right?
far as I know, it's unknown.
Because you're adopted.
But none of you guys have heart problems.
No. Hernia or any
cool.
condition that may be aggravated by lifting weights or physical activity. I think so. Okay. Have you ever, this is more health history questionnaire for the Wellness Fitness program. This is through the Federal Occupation of Health.
Like, for real? It's really gonna get sent to them?
No, this is just for my class
Okay.
project. I mean, if Dr. Abbott feels the need to send it there, then yes. Have you ever had any of the following? Heart attack, failure, or surgery?
No.
Catheterization or angioplasty?
No. No to all the heart stuff.
Pacemaker, asthma, COPD, lung disease, you have that. Diabetes, no. Thyroid disorder, yes, right? Okay. Kidney or liver disease?
Not disease, no.
Okay. Do you have any of the following? Cancer, back pain, arthritis,
Wait, stop. It's not considered a disease, but I do have sphincter of Odie disorder.
Why did it be complicated?
Okay, I don't care if you write it down or not.
Do you have any of the following? Cancer, back pain, arthritis, osteoporosis, musculoskeletal problems, blood clots, exercise safety concerns, or recent surgery, current pregnancy? So, cancer, because it's a new diagnosis, right?
Yeah.
You said you had back pain.
No, I have osteopenia, which is the stage right before osteoporosis. Verified on a bone scan. Yes. No on the blood clots. Yes on the exercise and safety concerns.
You don't have any recent surgery, no current pregnancy.
I don't have the plumbing.
Has the doctor ever told you should not exercise?
After surgery, but not any other time.
Even through your cancer and all that?
Only after surgery.
Okay. Only after surgery. Okay, if you answered yes to any of the questions 1, 2, 3, please describe. So give me a short summary of your COPD is from smoking. Your thyroid disorder is Hashimoto's. Is that like that's naturally, right? Like you didn't just. I mean.
It's a thyroid disorder.
Yeah. Okay. Cancer is. It wasn't genetic.
No.
Back pain is that from your cancer?
Mm-mm.
What's it?
It's from 30-something years of being a nurse.
Okay. Your musculoskeletal problems.
It's related to the thyroid.
Okay. And your exercise safety concerns.
Because I lose my balance all the time.
Okay.
But I don't fall. I get dizzy, but I don't fall.
I gotta sit back. My back's hurting. Have you experienced any of the following within the past 12 months? Pain or discomfort in the chest, neck, jaw, or arms at rest or
Yes.
at rest or during physical activity? Shortness of breath or wheezing at rest or with mild exertion?
Yes.
Dizziness, fainting, or blackouts?
Dizziness.
Dizziness. Difficulty breathing at night?
Yeah,
Except-
but I had whatever was going around for a minute.
So, I mean, not regularly though. Swelling of the ankles?
No.
You said no heart problems. Burning or cramping in the legs when you walk at short distances?
They don't cramp. They don't burn. They just feel very heavy and like they don't want to go.
So, burning or cramping would be no.
I guess.
Unusual fatigue or shortness of breath with usual activities? Are you a male of 45 years of age or older? No. Female, 55 years of age or older, have had a hysterectomy or postmenopausal, so yes. Have Either your father or brother prior to age 55 and or mother or sister prior to age 65 had heart disease, heart attack, or stroke? No. Do you currently smoke cigarettes? Yes. Do you engage in a moderate physical activity for at least 30 minutes a day on 3 days a week?
Yeah, usually.
Has your doctor ever told you you need to lose weight? No. Erasable pens are life. Has your doctor ever told you that you have high blood pressure or on a medicine to control? No. Has your blood glucose level ever been high, or has a doctor ever told you that you've had prediabetes?
Yes, my blood glucose is high, but my HbA1c, probably want to write that down, is low. It's below 5.4.
Over-the-counter medications you have been prescribed. Magnesium.
Mm-hmm.
Reason for taking.
Supposed to help with the joint pain, supposedly.
Dosage, you said 500 milligrams.
Twice a day.
Oh, I skipped a question. Has your doctor ever told you your cholesterol is high?
Yes.
Any other over-the-counter?
Tylenol if I need it.
Are there any medicines that your physician has prescribed to you in the past 12 months which you are currently not taking? That'd be a no.
I don't think so.
Are you currently being treated for any other medical conditions? Just the ones we've gone over. Okay. Now we're going to go to some lifestyle questionnaires. Sorry, Bub.
She owes you. Big time.
She already does.
Describe your major health, nutrition, and or fitness goals.
I'd like for my neck to quit hurting. I can't wait to get rid of these fake hooties.
What are 2 to 3 biggest barriers to achieving these goals?
Pain. And more pain.
Would a barrier be the fake boobs?
Oh yeah. They're way too heavy and way too big.
You're still recording, right?
23 minutes.
What are 2 to 3 greatest strengths that will help you achieve these goals?
Strengths? Because I'm stubborn as hell. You want me to lie?
No.
Goals.
Does physical therapy help?
Yeah, when I get to go.
Does the chiropractor?
Yeah, when I go.
Please check the box that best describes how ready you are to make these changes to your lifestyle to achieve these goals. Do not believe I need to change. We'll make changes soon. Would like to intensify changes. Would like to change but don't think I can. Recently started to make changes past 6 months. Made changes but relapsed.
What were the first 2 choices?
Do not believe I need to change or will make changes soon.
I hope the changes come after surgery, so yes, soon.
Okay, but you also recently started to make the changes. Like you've been going to PT and stuff, correct?
I was going to PT regularly, and then the insurance company decided that they could determine how many visits I need. So I haven't been in like
I'm gonna slip
3
those
weeks
two.
or something. I don't care what you put.
On a scale of 1 to 10, how important is change to you? 25?
10.
How confident are you that you'll achieve this change on a scale of 1 to 10?
6.
Health information. How would you describe your health? Excellent, good, fair, poor?
Fair.
When was the last time you visited your physician? Talk about your family physician.
2 or 3 weeks ago.
Wow.
2 weeks. Nutrition history. Have you ever followed a modified diet to manage a health condition?
No.
Do you follow a specialized diet?
No. A seafood.
Seafood unit. Who purchases and prepares your food? You. Correct? I mean,
Yeah.
Are you currently physically active? Like, do you actually exercise on a regular
No.
basis? Please list your favorite physical activities. Eating.
Gardening.
Tail.
That's what I was thinking.
What?
Gardening, ew. Wait,
Fishing.
Huh?
Fishing. I like to go fishing.
Wow.
There just ain't nothing in the state of Indiana where to catch it. Come on.
I am. What would you like to do with your weight?
Lose
Lose?
time.
What was your lowest weight in the past 5 years?
In the past 5 years?
Mhm.
145, I think.
Highest?
156.
Current?
153 maybe.
Height?
5'5".
This is some more lifestyle questionnaire that we've kind of already gone over, but I think this is our last set of papers.
Thank God.
Come on.
I'm coming. Okay, so physical activity in the last 12 months, how often do you participate in some kind of exercise?
No, not regular exercise. Like, oh, I'm gonna go walk a mile today. None.
What sport or activity has worked for you in the past? Gardening, I mean that's an activity. Laundry.
Yeah, that works.
Yeah, it gets my clothes clean.
What type of exercise do you enjoy and where do you go to take exercise?
I don't enjoy exercise anymore and I don't go anywhere.
What form of sport or exercise do you dislike and why?
Do I dislike? Basketball.
Why?
Because it's stupid.
What is your present occupation?
Alright.
Does your occupation involve much physical exercise?
Yeah.
What exercise or hobbies do you like to do in your spare time? This is during work, I'm guessing, because it's under occupation.
Smoke.
That's, I mean, that's a hobby, I guess. Stress. Rate yourself on a scale of 1 to 10, 1 being calmest and 10 suffering badly. What's stress?
From stress? You want to ask me that question today?
Okay, let's.
10.
On a normal.
7.
Okay.
Wow.
What situations make you feel stressed? Kids.
My kids.
I knew she was gonna say that. How do you relax?
I haven't killed him yet.
How do you relax?
Xanax.
That's not cute.
Smoking.
And Flexeril. And smoking. And
Do you think you eat a healthy diet?
sometimes.
Do you eat breakfast?
Nope.
Do you snack between meals?
Sometimes. Not very often.
I'll say that'd be no. Do you think you eat more than you need?
Sometimes.
I need yes or no's here.
No.
Thank you. How many calories do you think you consume in a day?
2,900.
That's a lot.
Just kidding.
Honestly,
Yeah.
1,500 maybe.
How many liters? That's what it says. How many liters of water do you drink? They're supposed to.
Not for real. Okay, does your professor count the water and coffee? Some people do and some people don't.
I'm gonna guess no.
Not enough.
Okay, but how many liters of
I
water?
probably don't drink a liter if you're not counting coffee and tea.
Do you consider yourself overweight?
Yes,
How much would you like to lose?
20 pounds.
Is the rate at which you lose weight important to you?
Yes,
Rate yourself on a scale of 1 to 10 as to how fit you think you are. 1 least fit, 10 most fit.
probably 2.
How good is your stamina?
It's fading.
So 1 to 10. 10's high.
6, 5 or 6.
How strong do you think you are?
About a fourth of as strong as I used to be. So what do you want me to say? Probably a 4.
How flexible do you think you are?
Probably a 4.
How coordinated?
Depends on what I'm doing, but I'm still kind of coordinated.
Yeah. So 1 to 10.
8, I guess.
How much time will you have to do exercise? Minutes per day, days per week. So how many minutes a day do you have?
Right now, do I have to exercise?
How much time will you have to do exercise? Minutes per day. How many minutes a day do you have to exercise? 9. Okay. So that'd probably be days per week as well.
Probably.
What do you want exercise to do for you in the next month?
Build up the strength of my neck and shoulders.
3 months?
Same thing.
A year? I just want to switch shoulders. Did you say same thing plus lose weight?
Yeah.
Rate your goals in undertaking exercise. Extremely important, quite important, or not very important.
Quite.
Okay, we're gonna rate, in your view, the following in importance. 1 least, or 9 most. Improve overall health.
Is there numbers in between?
Okay, yes, hold on. So here, look at this. From my understanding, we're gonna number these 1 through 7, or 1 through 9, and the most important. So, improve overall health, fitness, reshape or tone your body, performance or for a particular sport, moods and stress levels, flexibility, strength, energy levels, and enjoyment. Stress,
Yeah.
9.
I guess. Yeah, most important. Yeah. Eight.
So, what was your
7,
6,
6, 5, 4, 3,
2,
2.
1. Okay, last paper. And this is more health medical questions. Sorry.
Oh my gosh.
We know your name and your emergency contact, your physician. In the present and past, have you had or do you I can't talk. Currently have any of the following conditions? I can't say that word right now. A recent operation, edema, high blood pressure, injury to back or knees, low blood pressure, seizures, lung disease.
Hey, okay, but you have to define back. Because if you're saying back is from...
Do you have an injury to your back?
But in your class, back is from what? T1 to T12, T1 to S5, Or are you counting the neck?
Back.
Yeah, no.
No? Okay. You said no to heart attack. You said you have dizziness. You don't have diabetes, high cholesterol.
Yeah.
Oh, there's that. Use orthopenia.
Osteopenia? Yes, I
Oh,
do
that's
that.
it says orthopenia. The need to sit up to breathe comfortably.
Oh, no.
Okay. Shortness of breath at rest. Chest pains. You said no heart. You have calf pain.
No.
Pain, discomfort in chest, neck, jaws.
Yes.
No. Heart murmur, no. Fatigue or shortness of breath. Or just usual activities. Temporary loss of visual activity. Acuity or speech.
No.
Family history. We can't do that, can we?
What is it?
Like heart problems and stuff like that.
I can tell you, my kids don't.
Okay, so client was adopted. Okay, couple more. Activity history. Were you referred to this program? No. Why are you enrolling in this program?
I'm not.
Are you presently employed? Yes. You said your present occupation is an RN. Have you worked with a personal trainer before? Day of your last physical examination performed by a physician. It says a physician, so it could be
Wait. December. I don't remember the day, but 19.
you participate in a regular exercise program? No. Can you currently walk 4 miles briskly without fatigue?
Probably not.
Have you performed resistant training exercise in the past?
Yes.
Do you have injuries, bone or muscle disabilities? I don't know why I can't read today. That may interfere with exercising. Do you have injuries, bone or muscle disabilities that may interfere with exercising?
Yes.
Briefly describe.
Slipped and herniated disc C4 and 5. Questionable torn rotator cuff in the right shoulder.
How much and what was your age when you started smoking? So amount per day.
Well, are you counting secondhand smoke?
It just says, do you smoke? And I put yes.
Okay. Are you counting secondhand smoke?
No.
Why not? They say it's just as bad as smoking, so that
Okay.
would be 55 years. I was 20, 18 something.
Amount per day.
Pack.
Body weight, you said is 153. What was it 1 year ago?
About the same.
At the age of 21.
What was my weight?
Mm-hmm.
170.
Whew. Do you follow or have you recently followed any specific, you said no to dietary plans? We have a list of your present medications. When we have your fitness goals. Okay, wait 1 second.
12:17. What?
17?
12:17.
For what?
You guys can talk about that a different day. Give me 1 second. Okay, I believe that is all for this interview. Thank you. you for participating.
You're welcome.
You can stop.